The H1N1 virus took the world by storm last year, catching most of us off guard and putting us down for the count. Now, many health experts are saying we may not have seen the worst of it. As Rod Starnes explains in our cover story, H1N1 is poised to strike again, so we'd better be prepared.
The Centers for Disease Control and Prevention estimates that tens of millions of cases of H1N1 ravaged the United States last year. And while doctors typically see flu-related illnesses and even deaths every year, this particular virus had some unique characteristics that kept those in the medical community guessing for months.
We started seeing cases in April and May, which was very unusual. And there were cases throughout the summer, which is unusual. It was not confined to the cold months. We also saw a big uptick in it when schools started back, and those are their hot months, August and September.
Doctors like Payne Johnson felt the brunt of the epidemic as patient after patient walked through the door, sometimes with no better option than to tough it out.
6 months ago, there was no vaccination, so anybody who was exposed essentially was getting sick with it. Now there's the option of having the vaccination, and it's readily available now, so every pharmacy, most physician offices have it in stock. So we're seeing less cases. That's going to change in the spring when everybody who hasn't been vaccinated and hadn't been sick yet gets it again or suddenly becomes exposed.
Of course, with this possible resurgence of the virus, health officials are asking that we keep two high-risk groups in mind: the elderly and children.
We are offering the vaccine in the county schools. We're working with the city schools, and the vaccine is also being given in the city schools. We are talking to the parochial schools about offering it in the parochial schools. The vaccine is also available at all of our public health clinics 5 days a week, and it's on a walk-in basis. There's no appointment needed.
I think the parents need to, number one, get the vaccination themselves. Number two, get the kids vaccinated. The schools are having vaccination little workshops where they're having kids come in and get the vaccine, and lots of parents are not showing up to sign the consent, get their kids vaccinated. So parents need to go to those workshops. They need to sign the consent.
Schools and daycare facilities can be breeding grounds for H1N1, so Dr. Payne Johnson recommends the following ways to keep your child and others healthy.
My daughter's daycare, for instance, they're bleaching the toys and spraying it. There's like Clorox Everyday spray that's safe for kids to put their hands and mouths on. Coughing and sneezing should definitely be done in your sleeve if you can, or a paper towel, tissue paper, something like that to keep the respiratory droplets from spreading. I carry around wet wipes, sanitizing wipes when I go to the grocery store. Kids are going to be riding in the basket and spreading their little viruses.
And of course, it can't be emphasized enough.
Washing your hands. You can use hand sanitizer. We've got it in every single room in our office.
And if your children do get sick, Dr. Payne Johnson recommends you keep them home from school until the virus has completely run its course.
Right now they're saying 7 to 10 days after the last symptoms. So you're talking somebody who just feels a little bit sick, they're still infectious for 7 more days after that.
In that case, lots of fluids, bed rest, and TLC will help a child ride out the nasty virus. But again, take steps now to try to avoid that situation. You can check out more information on H1N1 prevention at our websites, WKNO.org and smartmedicine.tv, or call the Memphis and Shelby County Health Department hotline at 379-H1N1. With a little planning and a trip to the doctor for the vaccination, you and your family will be ready as you can be. For Smart Medicine, I'm Rod Starnes.